We also have people from education and social science. Okay, they talk about how to improve the education system, how to know more about the relationship between one and another. Okay, we also have people from health science and medicine discuss about, and also investigate about what are the new disease, what are emerging diseases, what is the new drug, whether it is effective or not. And finally, we have basic sciences, which look at the aspect from biology, chemistry, and also physics. So research cycle is a series of stages that help us work through the process of researching information and drawing conclusions. So usually it all starts with the literature search. When you look at all the published report, published paper, you discover the new thing, you discover something that, the gap, and you started to design a new project. Then proposal writing, and finally, you start the research. And after you have done the research, you gather the data and present in conference and then publish in the academic journal. But what is lacking here? So the conventional research project is usually researcher initiated, okay? And the communication and the knowledge is all shared among the scientific community. So this kind of research is important, but it is harder to get funding and published. So recently, people started to think that we have to bring people with different kinds of skills and expertise together. No one has everything that's needed. So this is the in thing, team science, where scientists and social scientists must work together to solve the challenges faced by society, from energy, water, climate, food, and health. So how to start multidisciplinary research? Even if you have 3 people from different area, how to start? All right. First of all, what is the common problem that these 3 people are having? And this common problem must be global challenges that have significant impact on different aspects. So like I mentioned before this, the conventional research are all researcher initiated, but now we focus more on what is the impact, okay, what you can bring to the society. So you must be able to solve those problems faced by the community now, and also the global challenges. So it can be, those problems which have the financial impact, health impact, and social impact. So the idea. Okay, so from now I'm going to share with you my research on antimicrobial resistance, which I have included multidisciplinary aspects. So do you know what is antibiotic resistance?
Anyone here want to give it a try? Oh.
All right. Yeah?
No.
It's okay. All right. So antibiotic resistance, it sounds like, it is nothing to do with you, but antibiotics resistance is actually happen every day in our daily life and take away lives every day. So it means that the antibiotic available in the market now are no longer effective to cure the infection. So why it is important and why people don't aware of it? Because people don't usually talk about antimicrobial resistance. So they don't really discover what is the reason behind the death. So AMR is actually one of the biggest threat to the modern medicine. Imagine if you have just a very, very common cold, okay, which caused by bacteria, but there's no antibiotic which can use to cure your infection, then what you can do is just to wait for the time to come. So if no action is taken, it could cause 10 million deaths each year by 2050. So this is announced by WHO, and it is a global challenge, right? And why we mention that, why we say that it will cause death and the economy lost, because if you are infected by multi-drug resistant organism, so the doctor have to try the antibiotic one by one to see which one can actually cure your infection. So this actually costs a lot. And in the hospital, they need to make sure that the infection will not be spread to others. So all these are actually money. So traditionally, okay, and scientists, when they work about the research on infectious diseases, so they begin to find out that, antibiotic resistance is actually caused by a few mechanisms, right? They can use the pump to pump up the antibiotics. They can use different mechanisms. And doctor, so before they do any research, they don't know what they can do with the infection because they don't know whether it is viral infection or it is bacterial infection. So they worry about, whether the patient, how the patient think, okay? And they also don't know whether to give antibiotics or not. But after they have done the research, they gathered information. They know that if these symptoms occur, it is probably sepsis, and they have to give antibiotic within 36 hours to make sure that the antibiotic can effectively cure the patient. And when scientists and clinicians work together, they can know which organism and which mechanism is used, to cause the disease, so that the doctor can have prompt treatment. So they even know that, whether there are any transmission, any spreading, and who is the cause, okay, and who spread it, right? So in the hospital, some of the hospital-acquired infection is actually spread by the healthcare worker because they don't wash their hands when they move from one bed to another bed. So with this, infection control can be implemented, right? And to improve the detection of antimicrobial resistance, when we work with the engineering side, we can actually improve it. So the traditional detection usually takes 5 days, but when we work with this newer technology, we can shorten the detection time to less than 1 hour, right? Then when we work with the ICT, work with the computer science, we can identify the risk factors. This is also mathematics, right? Then we can also predict the trends. We can know whether some infections some organisms are emerging, whether any disease are coming soon. And for health economic, we can also quantify the health resources that we have and organize, allocate, and manage it more effectively. And finally, we can also study the behavioral, because behavior study is a very important component in every discipline, okay? So we can do this among the patients, among the public, and also among the clinicians, among the healthcare worker. So we can do internal, meaning that individual factors. What are the individual factors? So we have this eye tracking study, which we track the focus of healthcare worker when they attended the patient. Where are their focus? Whether they are focusing on the patients or they are focusing on other things else, okay? And we also study the external factors. Then we ask their colleague, we ask their patients how the doctor treat them. All these external factors are very important component in preventing the spread. And after you have done all this, you need to return this or disperse the knowledge to the society. So we have this antimicrobial resistant awareness campaign. We also have the hand hygiene campaign. And most importantly, to educate the public that, to stop antimicrobial resistance, you need to make sure that your hand is cleaned, and then don't take excessive antibiotics. Yeah. Because some patients, they like to go to the doctor and ask for antibiotics. And every time you see your supervisors preparing proposal, okay, you see them stapling a bunch of CV to the back of the proposal. So if you think this is easy, I am going to tell you that it is not, because it takes time to build a good relationship, and you might also take time to find a good collaborator, right? So this is my pictures, the pictures of my fellow co-researchers for my MyRGS grant and also my TRGS grant. I'm one of the lucky researcher who got the MyRGS grant in 2019 and also 2020 last year. And I also organized some activities in school. So I brought my students to enter the, the schools, and then to guide them on how to prevent the antimicrobial resistance, how to make sure that you have the, you wash your hand properly. Yeah. And this is the pictures of the campaign, we held in the schools. And I also brought my student to one of my talk in petroscience. So this is the Meet with Scientists event. So during the event, we talk about science, talk about the more specific area like antimicrobial resistance to the kids. Okay, yeah. So yeah, my presentation today is very short, but I hope you enjoyed it. Thank you.
Thank you very much, Dr. Cindy. It's okay. Maybe we can have more time for the question and answer session. Anyone want to ask questions? You can raise your hand or you just type in the chat box. Probably I start first. Okay, so we know that this multidisciplinary research is getting more and more important, but what kind of challenges will be faced by the students when they are actually working on this multidisciplinary study or research?
Again, sorry?
Yeah, I'm asking actually what kind of challenges will be faced by the students, because we know that multidisciplinary study is very important, but when really working on it, students have to face some of the challenges when they are working on this multidisciplinary study.
Okay, one of my students is actually working on my RGS study, which we have the basic microbiology, we have clinical, we have machine learning, and also AI and eye tracking. So I can see that the problem she's facing is actually more on the area that she's not familiar with. So for this problem, I think supervisor have to play her role to make sure that the student is provided with guidance. Yeah, because my student is she's very microbiology based, so she's not very competent with how to do the eye tracking, how to do the machine learning, but with the help of the collaborators, yeah, she managed to do that. So I think it is important to talk to the supervisors when you are facing problem. Yeah.
Yeah, agree with that. Any more questions from the floor? Okay, there is one question here from Yang Si. Okay, could you please tell us something more about educating the public about the medical knowledge? What kind of combination can we do about medicine and education in research?
Okay. For medicine and education, okay, I can say that the public, they are not very well versed in the medicine or even the infectious diseases. So this, we can also see that when this COVID-19 pandemic strikes us, okay, so we are not prepared. And actually, and yeah, because all these infectious diseases are preventable, but we need to know more about the mechanism on how to prevent it. That's why in the beginning of the pandemic, we are not very keen to wear the mask. We are not sure whether do we have to wash our hands so frequently? Yeah, but based on research, we know that, how far the droplet can travel, and then so that we have to make sure that we have social distancing. and we have to wear masks, and then not even we have to wear double masks. Yeah, so all these are very important things. But I think to make sure that the public are aware of this, I think storytelling and experience sharing is very important. Yeah, so we might have more campaign, or more story sharing in the social media. This will indirectly increase the awareness instead of, like make it compulsory that you have to do this, you have to do that, because you have to let the public know the reason behind this. Why do we need to do that? Yeah, so I think that is very important. And finally, if we have managed to get together all the facts, we have to talk to the policy authorities, to make sure that something will be done, to make sure that all these are implemented based on the new policy. Yeah.
Thank you, Dr. Cindy. Yeah.
Thank you.
No more questions. Oh, okay. May I know what is the minimum number of disciplines involved to be considered as multidisciplinary research by Oi Siu Chen?
Okay, actually, if you have more than one, it is already considered multidiscipline. But if you want to solve the problem, because like what I said, one problem, one challenge is actually a common problem for different, sorry, okay, sorry for that. One challenge is actually a common problem for people from different disciplines. So it depends on the funding also. How big is your fund? Whether do you want to, expand it, from in what kind of capacity, whether you just want to solve the medical problem, you just want to solve the medicine combined with basic science, or medicine combined with the social science, or you include computer science. So all this actually depends on your funding.
Okay, so another student is asking, is there any specific weightage for the output of the research? Does it need 50 to 50 if involving two disciplines?
Not really. Sometimes certain aspect is actually to complement and then to provide evidence. Like the project that I'm doing with hospital, I'm providing evidence for them to implement infection control. So I have helped the hospital to trace the outbreak, so that I provide the evidence for them, so that when they show the doctors, they show the healthcare worker the evidence saying that, you see, this is what we got from your hand. We do the culture, this is what we got from your hand. And this is what we got from patient. It is the same, meaning that you are the one who bring this organism to the patient. So these are, important, but although we are just providing evidence, yeah. So there's no a specific, proportion for this.
Yeah. Another question? Yeah.
I saw this question talking about miscommunication. Yes, that's why I say that it is important to find a good collaborator, find the right one. Yeah, and communication is actually very important. We might want to have a meeting every month to update. Yeah, and most importantly, don't use your technical terms when you discuss the work, because sometimes if I use the terms, some people, if they're not in this field, they don't understand. Yeah, so we talk in layman language. Yeah.
Okay, sorry, I missed that question. Yeah. So next, you have important call, is it? Okay, so another question from Lai. So the student is asking, I'm looking into mangrove bacteria. Can I have some insight about sedimental bacteria and virus link, and any transdisciplinary suggestions?
Yeah, so when you look into mangrove bacteria, you can look at those which is beneficial and those which are not. So you try to involve those from the economy to look at the what is the loss and what is the, yeah. And also maybe engineering to monitor, the environmental, like heavy metals and all those things. Will that um, giving any impact? Yeah. Yes.
Oh, okay. I think no more questions from the floor.
All right. Yeah.
Don't be shy. Just ask. This is the chance. Otherwise, you guys can just drop an email to Dr. Cindy if you have any question about the multidisciplinary research. Right. Would that be okay for you, Dr. Cindy?
Yes.
Like if they have any question, they can just drop you an email.
Yes. Sure.
Yeah. Will you reply?
Yes.
Thank you so much, Dr. Cindy.
All right.
Thank you, everyone,
Okay,
for
thank
joining us today. Thank
you.
you,
Bye.
Dr. Cindy, for your time. Thank you, everyone.